Hi, very good morning. So today's live session, so it will be a textbook discussion. So as I posted some information in updates group, so you can go through it simultaneously on one screen and then follow the discussion. Okay, we'll have textbook discussion in the sense I'll go through the literature which is given in the textbook which we're following, and then we'll try to make up, like we'll try to highlight as many important points as possible. And in next live session, we'll have exclusive MCQ discussions from these particular topics, right? So I hope I'm audible. So do you have any issues with streaming or audio? Do let me know. And those who are new to our updates group, I just posted the link of the same in the comment section. You can download the Telegram app and join the updates group via that link. Okay. Okay, Rituja, rap on cherubism is awesome. Oh, just I tried it in a different manner. I hope it worked out, and I'll consider that to be worked out if it's fun. If it's fun to listen. Okay. So I appreciate your feedback, Rituja. So let's proceed with the discussion. Okay. I hope you guys have the hard or soft copies with you. So I would prefer a hard copy because it gives us a chance to underline various important points. Or if you have soft copies, at least take some printouts, right? If not now, at least later. So in today's discussion, we'll focus on adverse effects of NSAIDs. So adverse effects of NSAIDs, so adverse effects, side effects, secondary effects, toxic effects. So we have a lot many terms. So do you think these are all the same, or do you think these terms are different? Adverse effects, side effects, secondary effects, toxic effects, or adverse reactions. So we have several terms, right? You might have heard of all this. So do you think these are same? These are different? And it's needless to say, but your favorite side effects include. So whether you know the answer or not, these will be your common side effects, or we can say side effects, or even adverse effects, which we frequently write in our university theory exams. So, of course, these are our favorite, but apart from these, we have several other side effects, adverse effects. See, as the term itself implies, side effects are those effects which are seen secondary or side to the main therapeutic action. Side effects within the normal dose. Toxic effect is when something exceeds its normal pharmacological dosage, which is quite obvious. Then what about adverse effects? NHS website, a National Health Service of UK, clearly mentions that side effects and adverse effects are the same. But there are something called as secondary effects. I want you to find out the difference between side effects and secondary effects because you can find the same in this textbook. Okay, so do find out about the differences between, as I said, side effects and adverse effects are the same, but there is a difference between side effect, secondary effect. Of course, you know what's toxic effect, right? So consider these as your homework questions, and then we'll initiate our discussion, right? Yeah, of course. These are our standard answers, no matter what the drug is, non-specific and also easy to remember. Yeah, toxicity is when the dosage exceeds to that of normal therapeutic dose. Okay, guys. So if you observe page number 326, let's, as I said, we'll focus on adverse effects. So the shared toxicities due to PG synthesis inhibition. So NSAIDs work, you know the mechanism. So the shared toxicities include gastric mucosal damage, bleeding because of inhibition of platelet function. As you know, we have anti-platelet activity, and limitation of renal blood flow, leading to sodium and water retention, delay or prolongation of labor, asthma and anaphylactoid reactions, in susceptible individuals. So these are some of the shared toxicities due to PG synthesis inhibition. Okay. Also, we have some beneficial actions due to PG synthesis inhibition. That's the reason why these are indicated therapeutically for achieving analgesia, antipyresis, anti-inflammatory, antithrombotic, low-dose aspirin, and closure of patent ductus arteriosus in newborn. So consider these topics points very important and do underline them. We'll definitely frame MCQs from these topics. And in specific, in the next page, if you see page number 327, I wanted to highlight this ion trapping. In gastric mucosal damage, as you can see, gastric pain, mucosal erosion, ulceration, and blood loss are produced by all NSAIDs to varying extents. Relative gastric toxicity is a major consideration in the choice of NSAIDs. Inhibition of synthesis of gastroprotective prostaglandins is clearly involved, though local action inducing back diffusion of H plus ions in gastric mucosa also plays a role. We'll discuss about ion trapping in the subsequent section. Okay, so gastric mucosal damage. Okay, we'll go through the comprehensive or the summary of the adverse effects of NSAIDs first, and then we'll deal with each drug in specific. So, adverse effects of NSAIDs on gastrointestinal system include gastric irritation, erosions, peptic ulceration, gastric bleeding or perforation or esophagitis, as mentioned in page number 328. You can find the table over there. And renal toxicity or renal adverse effects include, as we discussed prior, sodium and water retention, chronic renal failure, interstitial nephritis, papillary necrosis. Hepatic, raised transaminases, hepatic failure, which is a very rare case. And CNS effects include headaches, mental confusion, behavioral disturbances, seizure precipitation. And hematological, because of this antiplatelet activity, we have bleeding tendencies, thrombocytopenia, hemolytic anemia, agranulocytosis associated with certain NSAIDs. We'll go through them as well. And miscellaneous or other adverse effects include anaphylaxis or anaphylactoid reactions in susceptible individuals, asthma. In fact, we were discussing about nimesulide in one of our previous study club discussions, where it is specifically indicated for asthmatic patients, as mentioned in Tripathi. Pruritus, angioedema, nasal polyposis, skin rashes, etc. So this is actually the summary of adverse effects of NSAIDs. So we'll go through each of the drug and its corresponding adverse effects at length. Okay. So I hope you're able to follow. You want me to modify the pace? Do let me know. Okay. So we'll start with aspirin. So in aspirin, if you look into I haven't shared that page. We have something called as ion trapping, which happens in gastric mucosal cells, because of which there is enhanced gastric toxicity. I wanted to highlight that particular point given in page number 321, 329. And coming to adverse effects of aspirin, acetyl salicylic acid. So side effects that occur at analgesic dose, which is zero point 0.3 to 1.5 grams per day, are nausea, vomiting, epigastric distress, increased occult blood loss in stools. And the most important adverse effect of aspirin is gastric mucosal damage and peptic ulceration, because with unintended inhibition of prostaglandins, gastroprotective or gastric mucosal protective prostaglandin. So we have headache, nausea, epigastric pain. Most importantly, gastric mucosal damage and peptic ulceration. I want you to highlight this particular point. Okay, hypersensitivity and idiosyncrasy, also an adverse effect. Anti-inflammatory doses, 3 to 5 grams per day. So produce a syndrome called salicylism, do underline this point, which includes dizziness, tinnitus or ringing sensation in ear, vertigo, reversible impairment of hearing, vision, excitement, mental confusion, hyperventilation, electrolyte balance. The dose has to be titrated to one which is just below to that of producing these symptoms. So do underline this point pertaining to salicylism and the features associated with salicylism. Aspirin therapy in children with viral infection, you know about rice syndrome. So do underline that point as well. An association between salicylate therapy and rice syndrome, a rare form of hepatic encephalopathy seen in children having viral infections like varicella or influenza. has also been noted. And in case of acute salicylate poisoning, so when the dosage exceeds to that of normal therapeutic doses in the range of 15 to 30 grams, which is considered as fatal dose, do underline this point. Fatal dose in adults is estimated to be 15 to 30 grams, but is considered or considerably lower in case of children. And serious toxicity is seen at serum salicylate levels of more than 50 milligrams per deciliter. So the fatal dose and the complications, serious complications associated dose do underline these points, okay? And the manifestations include hallucinations, vomiting, dehydration, convulsions, coma, and even death due to respiratory failure and cardiovascular collapse. Okay, so these are some of the adverse effects associated with aspirin in specific. Try to highlight the one which is given alongside the side effect, that is gastric mucosal damage, ulceration, hypersensitivity, okay, in susceptible individuals, salicylism, to underline that point as well. And in acute salicylate poisoning, the dosages, consider them very, very important. Also, ultimately, there can be death because of cardiovascular failure as well as respiratory failure. Right, so these are some 4 to 5 take-home messages, 4 to 5 points which you can take home from this particular section. And then we'll move on to ibuprofen. So in page number 332, you can see, yeah, hi, good morning. So in page number 332, you can see the adverse effects of ibuprofen, propionic acid derivatives. So ibuprofen and its all congeners are better tolerated than aspirin. Side effects are milder and their incidence is lower, nothing significant. Gastric discomfort, nausea, vomiting, though less than aspirin and indomethacin, are still the most common side effects. Gastric erosion and occult blood loss are rare. CNS side effects include headache, dizziness, blurring of vision, tinnitus, depression. Rashes, itching, and other hypersensitivity phenomena are infrequent. However, these drugs precipitate aspirin-induced asthma. Do underline that specific point. And fluid retention is less marked than that with phenylbutazone. They're not prescribed to pregnant women and should be avoided in peptic ulcer patients. So underline this final point as well. Okay. So regarding drugs which are prescribed in pregnancy, already we discussed that previously. Okay. Now, mefenamic acid. So adverse effects, diarrhea. So do underline this specific point. Diarrhea is the most important dose-related side effect pertaining to mefenamic acid. That's it. That's the only take-home message for you. Diarrhea. And then coming to diclofenac, which you might have heard of very frequently. Diclofenac adverse effects are generally mild, which include epigastric pain, nausea, headache, dizziness, rashes, gastric ulceration, bleeding are less common. But remember, no matter which side effects are we are going through, do remember the comprehensive adverse effects of NSAIDs, which we discussed prior. So more or less, these adverse effects are going to be present, but with each agent, the adverse effects, certain adverse effects can be more specific, as in case of mefenamic acid, we are seeing dose-related diarrhea as the most common adverse effect, likewise. So in case of diclofenac, so they're generally mild, epigastric pain, nausea, headache, dizziness, rashes, non-specific. Gastric ulceration and bleeding are less common. Reversible elevation of serum aminotransferases can occur. Kidney damage is rare. So nothing specific. Diclofenac is among the most commonly used. So you can just underline one specific point: reversible elevation of serum aminotransferases. Okay. So others are non-specific. And then piroxicam, common side effects. In page number 334, you can see piroxicam, common side effects are heartburn, nausea, anorexia. It's better tolerated and less ulcerogenic than indomethacin or phenylbutazone and cause less fecal blood loss than aspirin. Edema and reversible agitemia have been observed. Do underline this specific point. That is, it is less ulcerogenic and better tolerated than indomethacin or phenylbutazone. So I do underline that specific point. Ketorolac adverse effects again: nausea, abdominal pain, dyspepsia, ulceration, loose stools, drowsiness, pain at injection site, rise in serum transaminase, fluid retention. I wanted to underline three keywords: pain at injection site, because I remember seeing one question. multiple choice question pertaining to this pain at injection site. So pain at injection site, a rise in serum transaminase as well as fluid retention, just 3 points. And then Indomethacin, adverse effects, high incidence, up to 50% of gastrointestinal and CNS side effects are produced. Frontal headache. This was asked in 2018 or 2019, I guess. I don't exactly remember the year, but frontal headache, the keyword was used as a multiple choice question. So indomethacin, it's an indole derivative, and you can see high incidence of gastrointestinal and CNS side effects. Gastric irritation, nausea, anorexia, gastric bleeding, diarrhea are prominent. Do underline that specific point. And frontal headache, which is very common. So underline that point as well. Along with that, hallucination, depression, psychosis, leukopenia, rashes, and other hypersensitivity reactions are also reported. Increased risk of bleeding due to decreased platelet aggregability. Okay, so frontal headache and incidence of other adverse effects is comparatively higher, up to 50%, as mentioned here. Dipyrone or metamizole, there can be cases of agranulocytosis, because agranulocytosis was one of the adverse effects which we had seen previously. So do underline this point here. Few cases of agranulocytosis were reported, and metamizole was banned in USA and some other European countries. In fact, there was a question on one NSAID which is banned in India. However, it has been extensively used in India and other European countries. Okay. So agranulocytosis is one point which you can highlight over there. Nimesulide I wanted to discuss in detail because there are several important points pertaining to this. So nimesulide also, as we discussed prior, it is specifically indicated in asthmatic patients, even though it's banned because of certain reasons, as most of you might be aware of. Nimesulide, adverse effects of nimesulide are gastrointestinal, dermatological. Gastric tolerability of nimesulide is claimed to be better, but ulcer complications may be prevalent as with other NSAIDs. Recently, this is what I wanted to highlight. Recently, several instances of fulminant hepatic failure have been associated. Page number 336. So, fulminant hepatic failure with nimesulide, and it has been withdrawn in several countries. Considering that it has not been marketed in UK, USA, Australia, Canada, the overall safety of this drug, especially in children, has been questioned. However, most asthmatics and those who develop bronchospasm or intolerance to aspirin do not cross-react with nimesulide, and its specific usefulness appears to be only in such patients, asthmatic patients, as we discussed prior. So there can be cases of fulminant hepatic failure. Recent evidence suggests the same. Meloxicam gastric effects are milder compared to comparatively, but ulcer complications have been reported on long-term usage. Nothing much important to be taken from there. And narbumetone has caused lower incidence of gastric erosions, ulcers, and bleeding, probably because of active COX inhibitor is produced in tissues. Again, nothing important. Selective COX-2 inhibitors. If you go through selective COX-2 inhibitors, celecoxib, page number 337, you can see the point where I tried to mark. Though tolerability of celecoxib is better than traditional NSAID, still abdominal pain, dyspepsia, and mild diarrhea are most common side effects. The advantage we have with selective COX-2 inhibitors is that most of the adverse effects associated with traditional or conventional NSAIDs can be overcome, isn't it? So obviously, the incidence of beneficial inhibition of prostaglandins is not seen. Etoricoxib side effects are dry mouth, aphthous ulcers, taste disturbance, and paresthesia. Do underline this point. Dry mouth and aphthous ulcers, along with paresthesias. And finally, we'll conclude with this paracetamol, which we are all very familiar with, and the final aspect of our discussion, adverse effects in isolated antipyretic doses. Yeah, in isolated, page number 338, in isolated antipyretic doses, paracetamol is safe and well tolerated. Nausea and rashes can occur occasionally. Leukopenia is rare. Analgesic nephropathy. Consider this very, very important, which occurs after years of heavy ingestion of analgesics, because most of us have this habit of taking a painkiller for any sort of pain, like it can be mild headache or it can be a pain elsewhere. So, because of continuous or heavy ingestion or habitual ingestion of paracetamol, there can be accumulation of the same. And such individuals probably have some personality defect. The pathological lesions are papillary necrosis, tubular atrophy, followed by renal fibrosis. Do underline this specific point, okay? So there can be papillary necrosis, tubular atrophy, followed by renal fibrosis. Urine concentrating ability is lost and kidneys shrink. Because phenacetin was commonly abused, it was primarily implicated and went into disrepute, though other analgesics are also liable to produce similar effects. So we're dealing with two drugs here, not just paracetamol. We also have phenacetin, which is also a para-aminophenol derivative. And in fact, we had discussion pertaining to this in one of the study club or assignments, right? So acute paracetamol poisoning. So nephropathy is one issue we're dealing with, and the next one is excessive doses leading to poisoning. It occurs especially in small children who have low hepatic glucuronide conjugating ability. You can expect assertion and reason type of questioning here. So why children are more susceptible? Because of their conjugating ability. Hepatic glucuronide conjugating ability is low in children comparatively. If a large dose of more than 150 milligrams per kg or 10 grams in an adult, again, doses are very important, do underline them. If a large dose is taken, serious toxicity can occur and fatality is common with more than 250 milligrams per kg. Okay. And early manifestations are nausea, vomiting, abdominal pain, liver tenderness. Ultimately, there can be centrilobular hepatic necrosis, which can be accompanied by renal tubular necrosis and hypoglycemia. And jaundice starts after 2 days. Fulminating hepatic failure and death are likely if the plasma levels are high. And the mechanism of toxicity, the treatment part, we discussed previously as well. N-acetylcysteine infused IV or given orally is a specific antidote, as most of you are aware of, right? So these are some of the adverse effects of Nsights. So there are some common adverse effects along with which we need to be familiar with specific adverse effects, which are, which are specific to certain agents. So it's really difficult to remember all of them. But if you keenly observe, there are only specific points to be highlighted, specific points to be made note of. We spent around 20 or 30 minutes hardly and around 25 minutes, and we could extract some 10 to 15 points maximum from this session. And once you make a note of them, it hardly takes another 15, 20 minutes or maximum of 30 minutes. And it takes another 10 to 15 minutes for you to revise. So if you can invest a qualitative time of 30 to 40 minutes, you'll be completing and you'll be much aware and confident pertaining to this topic, adverse effects of NSAIDs. So the homework which I'm going to give you today is try finding out the difference between secondary effects, side effects, adverse effects, toxic effects. Try to have that clarity and get back through mail. And most importantly, we try to highlight certain points in this entire session. We try to underline and try to highlight. So do make a note of all those points, the common adverse effects together, and then followed by specific adverse effects like frontal headache, diarrhea, bleeding tendencies, thrombocytopenia, which we have come across, liver failure, nephrotoxicity. So specific adverse effects associated with specific agents. So do make notes. That's it. Take my word, you're going to have enhanced confidence. And that's the reason why we're doing this textbook discussion. See, it's easy for me to just vomit certain important points. But as I mentioned prior, as I've been telling you for the past several days, the objective here is to gain confidence through right strategy, through right methodology. So once you do certain things in a right way, even though if it is time taking, it's worth doing it, right? I hope you got my point, and if you have any questions, you're always welcome to get back to mail 24/7. So I hope you guys followed. Fine. It depends, Pradnya, depends on the degree of pain. Paracetamol, there is nothing like contraindication, but in cases where there is associated toxicity, we can go with other NSAIDs. If the pain is severe, we can even switch on to opioids, as we have seen. In fact, we discussed about analgesics in dentistry in one of the study club discussions last week. Do check it out once. Also, we discussed about some combinations, right? Yeah, Vidya, diclofenac, aceclofenac, we had gone through that as well. Okay, right. So forget about these adverse effects. This is only for fun. This is what is actually put on theory paper. These are non-specific, can be seen or cannot be seen. In fact, these adverse effects can be mentioned everywhere. Even after attending this live session, you can complain of these things. So these are non-specific. So what really matters is the specific information which we can obtain from standard literature. Yeah, Ankur, you can check out updates group. I've posted the information along with the edition. Rishabh, yes, of course. Check out doubt clarification form, get back through mail after referring standard literature. I'll be more than happy to guide you, no matter what your query is. Okay, so tomorrow at 10:30 a.m. Indian Standard Time, mostly 10:30 or 11, I'll let you know. Tomorrow we'll have MCQs discussion exclusively from today's textbook discussion, that is adverse effects of NSAIDs. Okay, we'll frame different range of questions, including multiple choice, assertion and reason, true or false, multiple right answers, and we'll get back to you tomorrow at 10:30 a.m. Indian Standard Time, right? And you have any questions, as you mentioned, you're always welcome to get back through mail 24 by 7. Okay, it's really good to see. Sunday or Monday, Rose Cow Ande, this is something we used to have that ad by NECC, National Egg Counseling Committee or something. So just like that, irrespective of the day, it's really good to see you guys actively participating and saying that, in fact, you are feeling enthusiastic to attend these discussions and give your best. I appreciate you for all your enthusiasm, which you have been exuding. All you need to do is just keep this consistency going. There are times where we feel demotivated and passivated. The reason why I'm trying to highlight this is because we are in a stage where we're not allowed to go out. We're allowed to stay indoors, and there can be, of course, side effects, adverse effects, toxic effects associated with this kind of environment, the situation which is prevailing currently. It's okay to feel low, but the most important thing is exhibit patience. Just be patient, and sometimes if you feel like things are not going in your way, sometimes if you're feeling confused and you feel like you don't know what to do, you feel like everything is getting wasted, just pause, take a break, watch a movie, relax, spend some quality time with your family and friends, if possible, with friends, either online or offline. But see to that you're maintaining social distancing, and then completely stay off the grid. Do not follow anything which is on social media, online news, nothing. And take a complete break. And then, once you have that qualitative break, it gives you an opportunity to rejuvenate, and then it allows you to give your best again from the next moment. Okay. So, and also, as I keep on telling you, if you need any assistance from our side, you're most welcome, and you're more than welcome to contact us 24 by 7. Right? Hi, Srilekha. Sir, I have mailed you regarding courses of the BDS, but you didn't reply. Srilekha, we usually reply within 24 to 48 hours. And by the way, I have already replied to your mail yesterday. You can check it out. Okay. Since you're saying I haven't replied, it means you haven't checked your mail. Do check your mail once. No, in fact, let me tell you frankly, it's definitely difficult. It's definitely difficult provided you resort to rote learning without applying proper methodology. But as I said, if you know how to do it, even though if it's a tough topic, use sticky notes, use marker pens, make notes. You are actually simplifying things for your benefit, for your convenience, and for sake of a revision at later date. So when you're simplifying things for you, that will enhance your confidence because you're going to remember them very, very easily. Okay. So, anyways, I'll see you guys tomorrow at 10:30 a.m. Indian Standard Time mostly. I'll post you an update and we'll have MCQs discussion exclusively from this topic. Okay, right. Take care. Love you all. Yeah, sure. I'll check out your mails. Yeah. Naveen, how do you be so passionate? You reply to every mail, prepare discussions. Oh God. No, see, that's a challenge I have, Naveen. Obviously, we do things based on a passion, but when you're reaching more and more people, obviously the workload increases. That's the reason why we put up a standard reply policy of 24 to 48 hours 3 years ago itself, because anticipating these dynamic changes, we thought of implementing that rule. It's not possible for me to reply instantaneously. I know we love instantaneous replies. That's there is nothing wrong in it. That's basic human tendency. When you ask me something, if I reply you at the very same moment, it's a good kind of feeling. But if I wait for 24 to 48 hours, most of the students get pissed. But I can set up someone and make them answer mails for me, but I'm not going to do that. I decided not to do that because students approach me because they believe in me, and I wanted to make sure that I am the actual person who is interacting with them and who is replying to their mails. So the, the reason why I'm telling you all of this is it's not possible for me, for that very same reason, to give you instantaneous replies. And that's the reason why we take 24 to 48 hours, which allows us to reply to all the mails, which allows me to reply all the mails within that stipulated time period. That's the reason why some mails we reply instantaneously, some mails 4 to 5 hours, and some mails take almost 24 to 36 hours, and some mails up to 48 hours. So it depends. It depends on various factors. It's very simple, Naveen. If you love what you're doing, no one needs to force you to do that. And if you love what you're doing, you will stay intrinsically motivated. Okay, okay, guys. Take care. Love you all.